Hi everyone, so in the previous video we talked about the gradings of knee osteoarthritis, and in this video I will tell you what are the suitable modes of treatment for each of these stages. If you want to watch this video in different subtitles, we have them in Bahasa, we have them in Tamil, we have them in Chinese, and you just need to click the subtitle options available. Now, grade 1 is usually what a lot of patients comes with, especially the younger patients. They have some difficulties or some discomfort on the knee, especially when doing activities. And what we will advise at all the stages is that you need to do physiotherapy. Now, when we talk about physiotherapy, it's not just about exercise to build muscle or get range of motion. Physiotherapy can also help you to control pain through the different approaches that is available to reduce pain and swelling. Now, typically for grade 1, you will rely on physiotherapy to build the muscle bulk, because the muscles around the knee, which are the quadriceps and your hamstring groups of muscles, are very important to stabilize the knee joint. These will prevent the knee joint from getting further injuries, thereby reducing the acceleration of knee osteoarthritis. Of course, you're also going to rely on medication. This can either be in a topical or a cream form, or on the oral side of it. Now, in grade 2, when the symptoms are more frequent, more severe, you have more frequent knee pain, which limits your activity, you might be dependent on certain supplements, which can also be used in the early stage. And these are supplements which are chondroitin based or collagen based, which is supposed to protect your knee joint, the existing cartilage, from getting damaged. And there are studies to show that it helps to repair a certain amount of damage, but definitely would not revert back to the original condition. Along with the supplements, along with the physio, you might be needing some medication to reduce the pain on and off. When it comes to the grade 3 of the condition, where it's more severe, you have some lot of excess bone formation and you have frequent symptoms around the ear. Supplements still can be taken. Physiotherapy is definitely something that you still need to continue focusing on the quadriceps and hamstring muscle, and definitely you might need to consider taking an HA injection. Now, I will be talking about the HA injection in my next video, so stay tuned for that. Now, in stage 4, this is where the most probable course of action is to do a knee replacement surgery, because injection usually doesn't work. I'm talking about HA injection. Steroid injection is not advisable. It is limited for use for certain group of patients, but knee replacement is a viable solution. Now, the aim of understanding all this is to make sure that we are not under-treating you and limiting your quality of life, and we are not over-treating you, means we are not subjecting you for surgery early. So stay tuned in my next video where I talk about HA injection and a bit on the supplements on how this can help you.